So Lisa Knisley is the Executive Director for Translating Emergency Knowledge for Kids, also known as TREKK, a national knowledge mobilization initiative that aims to accelerate the speed at which the latest evidence in pediatric emergency care can be accessed and used by healthcare providers and parents and/or families. She is also a PhD student within the Faculty of Nursing at the University of Alberta, with a focus on adapting child health resources to meet the information needs and preferences of Métis families in Manitoba. Prior to TREKK, Lisa worked in the UK, including roles as a research nurse and the manager of an initiative to improve patient information within the National Health Service. And as I mentioned a moment ago, both our presenters are recipients of the Spore Evidence Alliance 2019 SEED grant. So please go ahead, Lisa.
Thank you, Megan, and thank you everyone who's taken the time out to listen to these presentations today. I really appreciate it. So the objectives of my presentation today is hopefully learn some more about my plan to do an integrated knowledge translation, community-based participatory approach to developing child health resources with Métis families, learn about our plans to identify inclusive engagement strategies for this research, and explore a little bit about the researchers and the research team's roles in supporting and promoting Indigenous knowledge translation approaches. So I'm located in Winnipeg, and I just want to acknowledge that I'm on the original lands of the Anishinaabe, Cree, Ojibwe, Dakota, and Dene peoples, and on the homeland of the Métis Nation, and that I respect the treaties that were made on these territories and acknowledge the harms and mistakes of the past, and that I dedicated to moving forward in partnership and with Indigenous communities in the spirit of reconciliation and collaboration. So as mentioned in my intro, and thanks Megan for that, I'm a nurse. The majority of my nursing career has actually been from Canada, but I moved to the UK. The majority of my nursing career has been there. It's where I started my interest in developing patient information. I'm also a mom to these two boys and that furry puppy there. I don't know about you guys, but I'm currently with them pretty much 24/7 now. I'm also their teacher as well. So let's hope they've been told to stay away for this presentation. So let's hope they behave, but anything can happen. But hats off to everyone who's working from home and working in the hospital and managing as they can as we navigate through this pandemic. And I'm dreaming of the days when I soon can get to this place. This is called Clear Lake in Manitoba. It's a beautiful place that we can go hiking and relax as a family. So just a little bit more about my time in the UK. As I said, it's where I started my interest in developing information for patients and families. It's where I did my master's, which I'm a nurse, but I did my master's in journalism. And I worked on a patient information initiative, and the purpose was to establish a systematic process to develop and review the resources that were given to patients, make sure that the public was involved in developing these, and ensuring that they met national quality standards. And we did a lot of work to aim to try and make sure they were plain language, they were aimed at different ages, that we translated as needed. But it wasn't until I returned to Canada I started working with TREKK, and I had the opportunity to work with the TREKK co-directors, Drs. Shannon Scott and Lisa Hartling, who is part of TREKK's a very large initiative. A part of the initiative, they work on developing innovative ways to merge the stories and the experiences of parents who have sick or injured child and need emergency care, taking their stories and merging it with the latest evidence to co-develop with parents innovative knowledge translation tools. And these can be interactive infographics, videos, storybooks, ebooks, and so forth. And they have over a decade now of research into this method and the co-development. And if you want to see some of these tools, I encourage you to take a look at the website trekk.ca, as well as there are many publications on this process. And this is a graphic of the robust process. And if you look at that noon at the top, It's about identifying the condition, working with the parents to interview them to get their experiences, doing systematic reviews, and working with creative teams to develop the tools. And then there's many steps in terms of evaluating the tool, the prototypes with clinicians, refining them, doing usability evaluations with the parents, and then very purposeful, widespread dissemination of the tools. My work for my doctoral project lies in this area of translation and cultural adaptation, because I'll be taking one or a couple of those tools that already exist and adapting them with Métis families in Manitoba to ensure that they meet their information needs and preferences. So there'll be 3 phases. I'll be using interviews and focus groups to determine the information needs and preferences of Métis parents, adapting the KT tools with them, and then evaluating that tool with them as well as the process, the development process overall. So why are we adapting a tool with Métis parents in Manitoba? Well, Métis people are, for those who don't know, they're descendants of early economical, social, and political strategic relationships between North American First Nations and Europeans, and they have their own distinct languages and culture and their own distinct nation. Métis people might follow more Indigenous or more Western ways of knowing, yet Métis people remain in an interstitial space, with being neither First Nations nor general population. But much like the experiences of other Indigenous peoples, the Métis Nation has endured significant marginalization at the hands of the Canadian colonial settler state. They've been greatly impacted by the adverse consequences of colonization and ongoing attempts at assimilation, including residential school systems, systematic racism, and systemic racism and cultural oppression. There's over 71,000 self-identified Métis citizens in Manitoba. There's actually more young people and children, Métis children and young people compared to other Manitobans. And Métis parents have said that culture and positive sense of Métis identity is missing from the health services and have expressed a need for reliable health information, and that the health system has left much of their information needs unmet. So we believe there is a gap there. And also, the Manitoba Métis Federation, which is a democratic and self-governing body of the Manitoba Métis community, have said they're ensuring that Métis families have access to meaningful and appropriate materials when seeking emergency care for their children is important to them and also important to the Manitoba Métis community. So this project was identified by them, and that's why we are doing it in collaboration with them. So before I start my doctoral work, though, it was very important to be able to dedicate time to be able to engage with people from the Manitoba Métis Federation and Métis parents. And I was very fortunate to receive the grant that was mentioned from the Spore Evidence Alliance to do this work. And what it is we're planning 4 meetings or discussion groups within urban and rural regions of Manitoba, bringing together 5 to 10 parents, hopefully some others as well within each group. Unfortunately, that's been delayed at the moment. The ethics application, everything's planned as underway, but we can't obviously get together for in-person discussion groups. And we have explored doing this work virtually, but it was decided that that could create a barrier, that we may be limiting people's involvement who may not have access to the technology or the internet services needed to participate virtually. So we made the decision to honor that, and we're going to wait until we can meet as a group in person. And we chose discussion groups because it's an opportunity for people to bring their lived experience and experiential knowledge and often their unique perspectives on health issues to the research project. And the hope is that they're able to contribute to research, the decision-making around how we plan my doctoral research project, and also strengthen the research process. So the overall aim of this work is to build relationships with the Manitoba Métis Federation, in particular the great staff within the Health and Wellness Department, who have been huge support and help to this work. And I hope to develop a collaboration that can continue beyond my doctoral project. We also want to generate interest in the upcoming research for people who might be interested in participating in the advisory group that will help to inform all aspects of and oversee all aspects of my doctoral project. But also interest in participating in the parent interviews and the focus groups as well. And then I want to be able to develop an engagement plan that is respectful of Métis culture, language, expectations, and that creates safe spaces for the research to take place. And so some of the questions that will be asked in these discussion groups will focus around where should we look to find the necessary information to help us adapt the resources? Who should be involved in the research in addition to parents? How can we make it easier for Métis parents to be involved in the research project? How should we be recruiting parents? How can we make sure everyone's perspectives are included? What are some ways that we can make sure everyone feels safe when working together on the project? And by that I mean, exploring meeting space options for the focus groups, for the advisory groups. Are there things that we should be thinking about to make sure that the environment in the physical space is considered safe by everyone? Are there spaces that we should be avoiding? And the hope is that the questions will promote discussions on topics like avoiding reinforcement of existing stereotypes or biases, interpersonal interactions to promote a sense of safety for community members and the research participants, and also identify recommended maybe ideas for training, such as perhaps reflective practice for committee members. So this discussion group work has been informed by very much influenced and informed by this work by Carolyn Shimon and colleagues, which I'm sure many of you will recognize names here within the KT Canada community, and their work around incorporating a trauma-informed intersectional analysis. We know that our life experiences often include trauma, which can occur as a result of violence, abuse, neglect, disaster, and other emotionally harmful experiences, and a trauma-informed intersectional analysis will be incorporated to promote an understanding that we are all shaped by different social locations or categories, such as our race and our class. And the decision-making process can be complicated, complex and multifaceted for anyone that navigates the healthcare system, and for Métis families, it cannot be understood without also recognizing the effects of colonialism in shaping perceptions and decisions. And so the hope is that by having these discussions, this article has a lot of examples of research questions as well that you can use at different phases of your project, that it will help to help us use inclusive engagement practices and hopefully help to be inclusive and encourage people who are traditionally maybe less heard in research or may not necessarily participate in research because of due to experiences of unresponsive or disrespectful care, that hopefully we're able to create a more inclusive environment. So I'm hoping that the discussion groups will also help in the plan to use and adopt a strength-based approach and a decolonizing approach to my doctoral project. It's important that we work with Métis communities from a place of empowerment and resiliency and strength, promoting the positive and the strengths that the person or the community has. We know that there is already a very large and continually growing body of literature that demonstrates that Indigenous people bear a disproportionate amount of health inequities compared to the larger population. That is known, we know that, and so the focus is not on that, but promoting the strengths. And it's fostered through the researcher's ability to be transparent about themselves on a personal level and to engage in meaningful interpersonal relationships with community members and towards the highest good for the collective. And when I talk about a decolonizing approach, the aim is to create a balance between Indigenous and Western frameworks. It's a process whereby Métis voices and epistemologies will be placed at the center of the research process. It requires us to critically examine the underlying assumptions that inform the research and challenge the widely accepted beliefs that Western methods and ways of knowing are the only objective true science. It's about following the required ethical protocols, including treating the knowledge with respect and care, and the understanding that the knowledge is shared to benefit others. It's not about rejecting all Western methods and theories, but rather to be respectful and careful that when decolonizing research, to pay attention to the process and be ready to acknowledge and make changes as appropriate when Western methods or theories are not appropriate. And we'll also be using principles of integrated knowledge translation and community-based participatory research approaches. Both foster inclusive research engagement strategies, and while they both have distinct origins, both approaches promote close collaboration between the researcher and the involved communities. And they have the involved communities throughout the entire research project. So to inform whether the research addresses the community's needs to help with uptake of research findings, and also to involve the community stakeholders in things like research priority setting, design, delivery, and the co-creation of knowledge. Integrated knowledge translation opens the door for knowledge co-creation and the use of Indigenous knowledge translation approaches. It requires the researchers to engage with the Indigenous knowledge within processes that may not be clear, neat, and linear or straightforward. But along with the community-based participatory approaches, it can help to acknowledge power differentials, value different ways of knowing, and promote integration of Indigenous methods, such as sharing circles, community voices, and traditional storytelling. So within our research project, we will be valuing the unique Métis way of knowing. And this graphic is based on work done by Judith Bartlett, who describes Métis ways of knowing as acknowledging that knowledge can be gained from a holistic approach consisting of Indigenous ways of knowing based on narratives and experience. So those would be on the sort of orange-red side, and also Western approaches based on data and information to the blue side, and taking them all together to create a new tool. And adopting this Métis way of knowing framework will hopefully ensure that both the story and the experience, along with the data and the information, are going to be included in the interpretation of the discussion groups, the parent interviews, and the focus groups, and will be used to organize and examine information collected during this project within a context of Métis citizens' stories and experiences, as well as the stories and experiences of other stakeholders involved. So as I've been doing this work, it has me thinking a lot about the role of the researcher. I am not Métis, I'm not Indigenous, I'm a white woman, and I need to acknowledge and learn about the ontologies and the epistemologies and methodologies of the Métis Nation and support the development and implementation of K2 strategies that are relevant and useful to them. It's about building awareness and knowing and understanding that differences can be a useful starting point in contexts where differences have been previously ignored or overlooked. And this also includes an awareness that health research in partnership with Indigenous communities cannot be achieved without an awareness of racism in healthcare as well, which, as we, I think, all know, in light of everything that's happened over the last couple of weeks as well, that this is important. So to increase my awareness, I've taken classes and read literature, but I also know that learning can come from listening and observing and interacting with research partners. In fact, it's a key part of building relationships that are key to knowledge translation. And it's not necessarily just from the class readings or Western scientific methods. I recently, well, not recently, but there's a writer, Austin Channing Brown. She is a Black woman, writer, speaker, producer on racial justice, and she reminds us that, when you're building awareness, that it's okay to have lots of questions, and there's probably questions that we should be asking. But as a white woman, I have to do the work to answer the questions. It's not up to my Métis colleagues to teach me about Métis history, for example, or to answer each and every question I have, because there's many places to find those answers. There's essays, books, documentaries, online classes, lectures, so on. I think the point is that there's a lot out there. There's literally centuries of work to access, and it's up to me to be digging into to the work that's already out there. And it's about becoming culturally competent and working towards cultural humility. And that work might be uncomfortable, but important. And I just wanted to highlight some work by scholars and researchers that have really informed and influenced my work. Janet Smiley has done a lot of work on Indigenous knowledge translation, and there's been a huge, many publications on the topic. There's Two Eyes Seeing, which is a theoretical framework that embraces the contributions of both Indigenous and Western worldviews. There's literature and publications by Mason Dury, Elizabeth Esty, Leroy Littlebear, Shireen Razak, Sean Wilson, and also Willie Ermine and the Ethical Space of Engagement, which explores the idea of a neutral zone, which is formed when two societies with contrasting worldviews are poised to engage each other. And the ethical space offers a venue for cross-cultural conversation in pursuit of ethically engaging diversity and to diffuse claims to the human order. But I think we can all say that being aware and building awareness is important, but it's not enough. We also need to be accountable and to take action. And by accountability, for me, that's about exploring and using inclusive approaches to my work, following ethical protocols like the OCAP, so the ownership, control, access, possession principles, or in the case of the Manitoba Métis Federation, they follow OCAP, so that's ownership, control, access, and stewardship principles. And there's many types of action that can be on an institutional level or individual level. In the interest of time, I can't, that could be a whole topic within itself, but I'll talk a little bit just about individual action. So reflection is important as it can help us to understand our own worldviews, our own perspectives. This influences the questions we ask in our research, how we approach our research. It reminds us to challenge our thoughts, our situations, and our privilege. It encourages us to think about, who do you read and who do you cite in your work? Do you go outside your comfort zone to what other scholars and scientists have to say outside your discipline or your own worldviews? Who's on your social media feeds? Do they look like you? Do they have similar experiences with you as you? Because that also shapes your views. And so by asking these questions about our own culture, environment, social and personal history, it helps to deconstruct the ever-changing sense of ourselves in the research process. And so just lastly, some lessons that I've learned so far with this work: the importance of telling your story. When you tell your story, it allows you to be transparent about the motivations about why you're doing the research. That self-reflection is important, as I just described, using a strengths-based approach, consider trauma-informed, integrated KT, and participatory approaches. It's okay to feel uncomfortable. That can happen, and that's part of the process. But I think Robin DiAngelo talks about that if you do feel uncomfortable, that the key is to try to move forward with that discomfort. You can use it as a door out and blame the messenger, or you can use it as a door in by asking ourselves why we feel unsettled. And that is important as part of this process to do the work. So I'll end there. I just want to thank everyone who has helped me with this project. Dr. Shannon Scott's my supervisor, Michelle Dryger and Lisa Hartling are on my supervisory committee, and Dr. Julianne Sanguins is from the Manitoba Métis Federation, and they've been a huge help. with this work, as well as the support from the Spore Evidence Alliance and the other organizations that are on the screen. And thank you very much.
Thank you, Lisa. So again, I have a couple of questions to get the ball rolling. So my first question for you is, what are your thoughts on integrating Indigenous and Western knowledge within a KT tool?
Yeah, well, I hope I will be able to one day come back and tell you more about that when I do my doctoral project. I think that there's a lot of debate on the merits of the two knowledge systems, and that can sometimes distract from maybe other opportunities to explore where the two systems interact and how that can create opportunities for new knowledge that reflect both systems. So I would say that it's certainly a topic of interest. I don't have an answer, but I do think it's a place that requires exploration.
All right, thank you. And one more from me. What will you do if the in-person discussion groups can't take place in the near future?
Yeah, so we've had discussions as a team about that. I think it's something that many people, not just our research team, but other people across the country, it's a challenge. We're going to have to discuss. Dr. Dreger is also as a Métis scholar and works with the Manitoba Métis Federation as well, and I think it'll be a case of people coming together and exploring other ways that we can do this. Whether it does end up being virtual, I'm not sure. If it does, it'll certainly need to come with additional support to make sure that, you know, as I said, it's not a barrier for people, that we are not leaving people out who don't have access to the technology. But we will do our best to explore other options to make sure that we can have these discussion groups and inform an engagement strategy.
Well, thank you. Yeah, it's definitely a time of learning how to adapt, I guess.
For sure, yeah.
Well, thank you. I don't see any questions coming in at the moment. We still have a few minutes if anyone thinks of a question that they want to ask, and in the meantime, I'll start my spiel. So our next session, well, first of all, thank you so much, Dr. Wirtz and Lisa Knisley for your presentations today. We're really lucky to have two really interesting presentations. So thank you so much, and thank you everyone who joined us online today.